This is an ultrasound examination of the abdominal aorta to rule out abdominal aortic aneurysm. In this first image, the proximal aorta has been measured and is 2.7 centimeters in an AP dimension. This is within the normal range. The Pulse-Doppler of the proximal aorta demonstrates continuous flow throughout the heart cycle, and this is normal for the proximal aorta. The mid portion of the aorta measures 2.6 centimeters in AP and 2.5 centimeters in width. The 2.6 centimeter measurement may be slightly exaggerated because the AP is measured in an transverse scanning plane. A sagittal scanning plane is best for this measurement. Both of these measurements are normal. The mid-aorta measures 2.6 centimeters in a sagittal scanning plane. The Pulse-Doppler waveform is high resistance. There is reverse flow and a weakly demonstrated triphasic flow. This indicates that the Doppler was likely performed below the level of the renal arteries. This is normal. The diameter and AP of the distal aorta has been measured. The largest diameter is AP is 2.5 centimeters. The AP dimension of the distal aorta as measured on the sagittal scanning plane is 2.1 centimeters. This is normal. The Pulse-Doppler waveform demonstrates high resistance flow. There is triphasic flow demonstrated, and this is normal for this portion of the aorta. Color flow fills the entire distal aorta. It also fills both the right and left common iliac arteries. The diameters of the common iliac arteries have been measured on the same image. This is likely to overestimate at least one of these vessels since they usually are not parallel to each other. The AP dimensions were also measured in a transverse image. While these numbers are not greatly increased in size, they do indicate ectasia of the iliac arteries. A sagittal image of a grayscale image of the right and left common iliac arteries is shown along with the color Doppler in transverse of the distal aorta. The right common iliac artery is shown to fill completely with color Doppler, indicating no plaque or at least a paucity of plaque. The grayscale image adds to this conclusion. The Pulse-Doppler of the right common iliac artery demonstrates a triphasic flow pattern which is consistent with normal flow. The mid right CIA demonstrates also a third or a triphasic flow, and the distal portion is difficult to assess, although it is certainly high resistance flow. The right common iliac artery fills with color and has a triphasic waveform. The left common iliac artery in the proximal region fills with color, indicating a small amount, if any, plaque. Grayscale adds to this conclusion. The proximal left common iliac artery demonstrates high resistant flow with cessation of flow during diastole. There is no clear demonstration of reverse flow on this waveform, although it appears to be somewhat turbulent. The Doppler waveform from the middle common iliac artery demonstrates quite clearly that there is at least a triphasic flow and possibly tetraphasic flow, indicating normal blood flow in this vessel. The left common iliac artery distally demonstrates some Doppler noise, and this may be due to patient motion or to gas bubbles in overlying bowel. It appears to be, on a couple of the waveforms, still high resistance in nature. The left external iliac artery fills completely with color flow, indicating a paucity of plaque, and a solid four-phase blood flow pattern is seen: forward, and reverse. This indicates normal blood flow in this vessel. Ultrasound examination of the aorta, including color Doppler and Pulse-Doppler of the aorta, as well as common iliac arteries and external iliac arteries, indicates an ectatic aorta and continuance of the ectasia in the common iliac arteries without evidence of aneurysm, plaque, or stenosis.